One of the newest things now available for improvement of the neck is a new injectable product named Kybella. You may have heard about it. It's been in the news recently. It's the first FDA-approved injection to dissolve fat. There have been many injections in the years past that have been used to dissolve fat, but this is the first time the FDA has actually approved it. And it has similar products and ingredients that were in injections in the past. But now we have an area that's approved to dissolve the bulge of fat underneath the chin. And in many ways it'll be helpful. In many ways there's some downsides to it. First of all, removing the fat underneath the chin with injections takes several treatments. And it can be costly because the product itself is relatively expensive. Some people are talking between $900 to $1,200 per treatment, and you may need 3 or 4 treatments, so you can see it can add up pretty quickly. But the biggest issue is whether it is as effective over time as a simple liposuction that can be done in this area under local anesthesia with much less risk of scarring and irregularity. So there's going to be a group of patients who are going to certainly want to do something simple like an injection. However, the jury is still out on how effective it will be in the long term, because it will create some scar tissue that may make a future facelift difficult or may leave some loose skin. And I think that's the big issue, is the skin has to be tight enough that if you remove the fat, the skin will shrink into the new contour and look appropriate. So if you're thinking about Kybella and the new injection process, it's great that we have that option, but make sure you consult with a board-certified plastic surgeon to make sure you're a candidate, because not everyone who has fat under the neck is a candidate.